How is transurethral resection done for bladder tumors? Have you ever wondered how doctors remove tumors from the bladder? Transurethral resection of bladder tumor, commonly known as TURBT, is a key procedure used to diagnose and treat bladder cancer. This method is especially effective for non-muscle-invasive bladder cancer. The beauty of TURBT is that it does not require any external cuts, making it less invasive than other surgical options. The procedure starts with the surgeon inserting a thin, rigid tube called a cystoscope through the urethra and into the bladder. This cystoscope is equipped with a camera and light, allowing the surgeon to see the inside of the bladder clearly. The surgeon can view the bladder lining directly through an eyepiece or on a video screen. Once the tumor is located, specialized instruments are passed through the cystoscope. These instruments often include a small wire loop or cutting device. The surgeon carefully cuts and removes the tumor tissue from the bladder wall. After removal, the tissue is sent to a pathology lab. This lab analyzes the tissue to determine the cancer's state and grade, which helps guide further treatment decisions. In some cases, advanced techniques like blue light cystoscopy may be used. This involves instilling a special dye into the bladder before the procedure. The dye causes cancer cells to glow under ultraviolet light, making it easier for the surgeon to detect and remove smaller or less visible tumors. TURBT is typically performed under general anesthesia, where the patient is asleep, or regional anesthesia, which numbs the lower body while the patient remains awake. Since the procedure is done through the natural urinary passage, there are no external cuts. This usually results in a quicker recovery and fewer complications. After the procedure, patients may experience some discomfort or pain during urination for a short period. Depending on the risk of cancer recurrence, additional treatments may be recommended. One common approach is intravesical therapy, where chemotherapy or immunotherapy drugs are placed directly into the bladder. Sometimes, a second TURBT is performed within weeks if the initial tumor was high risk or to ensure complete removal of cancerous tissue. Overall, TURBT plays a crucial role in bladder cancer management. It combines diagnosis, staging, and initial treatment while preserving bladder function and minimizing invasiveness. Always remember, if you have questions or concerns about bladder health, it is essential to consult with a healthcare professional for personalized advice.